Hello and welcome to Global Market Bulletin TV. In today's feature executive interview, we have our guest, Adam Levy, Chief Executive Officer, President, and Director of Nexgel, a leading provider of ultra-gentle, high-water content hydrogels for the healthcare and consumer applications. The company trades under the ticker symbol NXGL. Well, Mr. Levy, thank you so much for joining us. And can you please introduce yourself and tell us a bit more about your company for those who are not familiar with your work?
Sure. Thank you for having me. So we're very excited about what we do here at Nexgel. Hydrogels are on the market. People are very used to them. They like them. They feel great. But most hydrogels are cross-linked water and polymer. All hydrogels are that. But most are cross-linked using chemical initiators and UV light. We do not do that. We use the big machine you see behind me, which is an electron beam accelerator. And by using the energy of that machine, we are able to skip all those chemicals and create what are virtually sheets of water, up to 95% water, much higher, and without any of those sort of caustic and irritating chemicals that the other hydrogels possess. So if you think about certain applications, dermatology, beauty and cosmetics, certain medical device, drug delivery, those chemicals are really non-starters. So we provide an alternative where a patch could be suitable, where before it was not.
Fascinating, fascinating. Well, you also have a fascinating background yourself. You're a former investment banker, as well as the president and CEO of Warlock Records from its inception in 1985, where you led the successful turnaround of several financially distressed music companies as part of a roll-up strategy. What is that experience? How has that experience helped you guide through Nexgel?
Well, in a number of ways. I mean, if you think about it, music is the ultimate consumer product, right? And you really, when you're putting out music, you believe you know what the consumer is going to like. You think you know, but you really don't until it comes out and it gets played on the radio and you find out. And most consumer products are similar to that. Very often the biggest companies put out products they think are going to be wildly successful, and it just doesn't resonate with the public. And that experience of making sure that you're always humble about what you do and don't know, and testing your product. Because we own the manufacturing facility, we can make our product in small batches. There's lots of great outlets now like Amazon where you can start to test market and get data on your product. And our ability to do that and not make the large mistakes is critical, for a smaller size company such as us, such ourselves.
Absolutely. Now, recently you announced positive results from your proof of concept study for diclofenac hydrogel patches. The patches are designed to treat pain indications such as arthritis, joint pain, muscle aches, and a lot more. Can you give us an update regarding that information and any executive commentary regarding the news?
So the news wasn't intended to be, and the study wasn't intended to be so much about we've built a better diclofenac patch, although it seems like we might have. It was really sort of proof of concept studies to show what an excellent delivery system we are. So the endpoints were things like skin penetration, skin retention, delivery of the additive or active to a site. This is something that makes us usable in a number of different indications and opens up a lot of doors. We are going to seek to partner that, probably, that indication and or others. But the truth is we make a very skin-friendly adhesive product that will not tear or injure sensitive skin or fragile skin, and yet is an incredibly effective delivery mechanism. And that's what those studies were really designed to show. We're in the very, very early stages of actually having a finished diclofenac patch.
How far off do you see it being released?
Well, the regulatory pathway, because we're actually so effective at delivering, you're starting a lot of your studies over again, safety, it's going to require the agency, it's probably going to require us to attract a partner. But the beauty is that this data will help us do that. This data shows just how remarkable the end product could be. And we believe that that's going to generate, and by the way, has already generated significant interest from potential strategic partners.
Oh, very interesting. Well, in addition, the company also announced it has developed a new proprietary hydrogel eye patch to treat amblyopia, a type of poor vision that typically occurs in one eye but can occur in both eyes, also known as lazy eye, which is another major move for your organization. The patch is expected to be available for ophthalmologists and optometrists to offer their patients in the first half of 2023. Can you tell us a bit more about that?
Yeah, this is a project we're very excited about and has a relatively short runway to market, as you pointed out. This condition affects 3 to 4% of the children in the United States. So at any given time, we estimate that there's between 250 and 400,000 children. Patching is by far the best standard of care method. It's the most efficacious, but it has its issues. So basically there's three types of patches. If you think about it, there's a pirate patch. There is a patch that goes over glasses, and then there's the patch that is adhered directly to the eye. The problem with the first two is that children tend to cheat. So imagine you're 5 or 6 years old, you're trying to play a video game, you can't see well. What do? They lift up the patch. And that really affects the efficacy of the treatment in general. So the preferred method is to put something that's affixed to the eye, so there's less of that going on. The problem is when you're using traditional adhesives, within a few days, you can often cause a lot of redness, pain, irritation to where the child doesn't even want to wear the patch. So what's great about this product is it goes on, it stays in place, it can be left on for whatever the treatment period time is, 4, 5, 6, 8 hours, and it comes off completely painlessly. It feels cool and great the whole time that it's on, and we think it'll make a real difference in these kids' lives.
Oh, certainly. What do you feel is the current biggest problem and market opportunity for hydrogels that NXGL is working to address?
Well, we think there's a tremendous amount of opportunity here just in the fragile skin and skincare market. So in medical device, it's pretty much anywhere that a device has an interface with skin, where particularly adhesives can over time cause a lot of that irritation and pain that we talked about. If you think about the elderly population that could have very fragile or crepey skin, diabetics, people on certain drugs like blood thinners, when they get just a bandage on them and it is taken off, they can tear or rip or bruise or injure their skin. So we've created solutions that can help hold lines in place, hold devices in place, such as the amblyopia patch and others that are incredibly gentle to the skin and won't cause more damage just by being there.
We kind of touched on this a little bit earlier, but in terms of what is next, is there anything new or exciting that investors can look forward to in the next, say, 6 to 12 months?
Well, the message that we're sending out now is resonating not only for our own products, but also with others. So one of the opportunities, and again, it was originally the first plan. We've done very well with our own proprietary brands, but that was not part of my original plan. COVID sort of pushed us in that direction. I was really trying to pursue a white label and custom label. So the attraction of a large partner and this is the target audience we're going after. Imagine a company has a lotion, a cream, or a gel. It's for an indication, wrinkles, eczema, psoriasis, whatever that may be. And they have that lotion, cream, or gel, but they've never been able to have a patch, because a patch to be held in place has to either have adhesives or these irritating hydrogels. So we've now created a gentle alternative. We can become a true line extension for an existing brand that's already successful. And we think we're going to, and we are in discussions with several folks. We think we're gonna have some very nice announcements along that front. We think we're going to make progress with our drug delivery programs, our own medical device programs, and we're seeing growth in our own brands. And we'll be releasing more SKUs in the coming months. And we think that part of the business is going to grow very nicely as well.
That's wonderful. Now, you may have already answered this, but would you say that you have anything else down the pipeline, say, in the next 3 to 5 years beyond what you just explained?
Oh, well, yeah, I mean, it's hard to look ahead 3 to 5 years in terms of that, but we believe that, we're going to have remedies for the adult at home market, bed sores. There's just so many applications where people could really use some relief for their skin. And we see almost endless opportunity. It's like kind of like drinking water through a fire hose. We put all of our opportunities on a big board, and we try to pick the ones that we think are fastest to market and that get us there. But there's no dearth of ideas. We have lots and lots of opportunity.
Wonderful. Incredible innovation. Well, it's been extremely informative. Could you please let the audience know the best place that they can go for additional company information?
So our website is very informative on the company side, nexgel.com. But we also have our own branded products to give you an idea of the sort of indications that we're currently addressing. Our brand is called Metagel. So Metagel, Medagel.com is another source, particularly if you're interested in the consumer products. That's where you'd find most of them.
Perfect. Well, thank you so much, sir. This is so incredibly informative and so interesting. We really look forward to monitoring your company's progress and speaking with you again in the future. Well, that's going to do it for us. We'll see you again next time.